welcome back to the channel. I'm genuinely grateful you're here because what we're discussing today could fundamentally change how you protect one of your body's most vital filtering systems. I want to tell you about George, a 72-year-old retired pharmacist from Indiana. George spent 40 years managing medications for others, watching their health trajectories, understanding what works and what doesn't. But something remarkable happened to him, and it's the exact reason I'm making this video right now. George came to me about 3 years ago with a troubling discovery. His kidney function had declined to the point where his doctor prescribed medication he had dispensed to patients for decades. He felt devastated, almost betrayed by his own body. He said, and I'm paraphrasing here, "I taught people about kidney disease, I warned them about the risks, but I didn't see it creeping up in myself." Here's what troubles me most about George's story. According to Harvard Medical School research, approximately 37.3% of adults over 65 experience some degree of kidney dysfunction without knowing it. Not suspecting it. Not having obvious symptoms. Simply unaware until the damage is significant. That statistic haunts me because George represents millions of people watching right now who have no idea their kidneys are sending distress signals. Let me be absolutely clear from the start. This is education, not medical advice. Never stop medication without consulting your doctor. Never self-diagnose based on what you hear in this video. What I'm sharing comes from decades of clinical observation and peer-reviewed research from Harvard Medical School, but your personal health decisions must always involve your physician. Now, why am I telling you about George specifically? Because his story contains 5 critical warning signs that people consistently miss. And more importantly, George discovered what happens when you finally pay attention to those signs. His health trajectory shifted. Not reversed entirely, but stabilized. He regained control of a situation that felt out of his hands. The first warning sign that most people dismiss is fatigue that doesn't match your activity level. George described it as a heaviness that followed him everywhere. He'd wake up exhausted even after 8 hours of sleep. Now, fatigue has 1,000 causes, I understand that. But persistent, unexplained fatigue combined with what I'm about to tell you becomes significant. Second, George noticed his appetite changing. Not dramatically, but subtly. Certain foods tasted different. Meat started becoming unappealing. He attributed it to aging, to changing preferences. But what he was experiencing was uremia beginning, the accumulation of waste products that healthy kidneys would filter out. His body was sending him messages in the language of taste and appetite. Third, and this is where many people get confused, George experienced subtle swelling in his ankles that he barely noticed. He thought it was his new shoes. He thought it was standing too long. He didn't connect it to the kidneys because nobody had taught him to look for that specific signal. Well, actually, let me rephrase that. Nobody had educated him to trust his own observations enough to investigate further. Fourth, George started making more trips to the bathroom, particularly at night. We call this nocturia in the medical world. Now, men his age expect this. It's almost normalized. He didn't question it. But frequent nighttime urination can indicate that your kidneys are struggling to concentrate urine properly, losing their ability to preserve fluid efficiently. Fifth, and this emerged slowly, George noticed his skin became drier and itchier. He bought expensive lotions. He tried different soaps. Dermatologists might examine him and find nothing specific. But dry, itchy skin can signal the buildup of phosphorus in the blood, which happens when kidney function declines significantly. The remarkable part is this. George had all 5 of these signs for approximately 2 years before his kidney function test revealed the truth. 2 years of his body communicating clearly, and 2 years of his mind rationalizing each signal individually rather than recognizing the pattern. Here's a biological truth that often gets overshadowed in mainstream health conversations. Your kidneys are like the water filtration system in your home. Imagine your kidneys as specialized filters processing about 180 liters of fluid daily, extracting the waste your body produces while preserving everything essential. When that system begins failing, it doesn't send one clear alarm. It sends multiple subtle messages across different systems. Your cardiovascular system responds first. Kidneys regulate blood pressure through fluid balance and hormone production. When they weaken, blood pressure often rises. George's blood pressure had climbed from 132/85 to 148/92 over the course of 18 months. His doctor adjusted his medications, but they never connected this elevation to kidney function decline until the comprehensive metabolic panel revealed creatinine levels of 1.82 mg per deciliter. That creatinine level is significant. Normal kidney function typically shows creatinine under 1.2. George's indicated he was functioning at approximately 43% of normal capacity. When you reach that point, the cascade of complications accelerates. The second system affected is your mineral metabolism. Healthy kidneys regulate calcium, phosphorus, and vitamin D in sophisticated ways we're still discovering. When that regulation fails, calcium becomes depleted while phosphorus builds up. Patients describe symptoms like muscle cramps, bone pain, and that persistent itching we discussed. George experienced all three, each interpreted separately before being understood as interconnected. The third system is your red blood cell production. Kidneys produce erythropoietin, a hormone that stimulates bone marrow to create red blood cells. When kidney function declines, red blood cell production drops, causing anemia. This explains the fatigue George experienced. Not laziness. Not depression. Not age. But genuine oxygen deficiency at the cellular level because his kidneys had stopped producing the signal for his body to make adequate blood cells. Have you noticed these changes in yourself? A bit more tired? Less interested in foods you used to enjoy? Puffiness in your ankles you attributed to something else? These questions help you recognize that your body speaks constantly if we learn to listen. Here's what George did after his diagnosis. He educated himself with the diligence he'd brought to pharmacy. He asked his nephrologist about remaining function, filtration rate, decline rate, and interventions. His doctor explained they'd caught him at stage 3B, moderate loss of kidney function but not yet requiring dialysis. At that stage, interventions can genuinely slow progression. His interventions began with diet. George worked with a renal dietitian to reduce sodium to under 2,300 mg daily, limit phosphorus, moderate potassium, and adjust protein appropriately. This is precision nutrition reducing workload on remaining function. Second, his nephrologist prescribed an SGLT2 inhibitor, kidney protective medication that slows kidney function decline by approximately 27%. Third, he increased aerobic activity to 150 minutes weekly plus resistance training twice weekly. Blood pressure control became paramount. Fourth, he moved to quarterly monitoring of kidney markers instead of annual checkups, allowing rapid intervention if decline accelerated. Now, here's the stunning part of George's story that's relevant to you watching right now. 3 years into these interventions, his kidney function has remained stable. Not improved in the sense that the damage reversed, but stabilized at approximately 45% function. His initial trajectory suggested he would decline to stage 4 or 5 within 5 years. Instead, he's thriving with stable function, good quality of life, and genuine hope that he'll never require dialysis. George acted on subtle signs before catastrophic symptoms emerged. The challenge is that most people don't act until disease becomes severe. George had pharmacy knowledge. Many of you don't. So let me translate what your body might be saying if your kidneys are struggling. That fatigue that you attribute to age? It might be your kidneys. That appetite loss and taste changes? Your kidneys might be losing the ability to manage waste products that affect your palate. That swelling in your feet and ankles? Your kidneys might be losing the ability to regulate fluid properly. That increased nighttime urination? Your kidneys might be struggling to concentrate urine and preserve water. That dry, itchy skin? Your kidneys might be accumulating phosphorus. Each of these signs is deniable on its own. But together, they compose a pattern that deserves investigation. An investigation is simple. A basic metabolic panel costs roughly $60 to $100. It measures creatinine and provides your estimated glomerular filtration rate. That single test tells you definitively whether your kidneys are functioning optimally. Here's what troubles me most. I speak with many people, perhaps like yourself, who haven't had a comprehensive metabolic panel in 5 to 10 years. They trust that they're fine based on feeling fine. But kidney disease progresses silently until it reaches advanced stages. You can lose 50% of your kidney function and feel completely normal. The symptoms emerge gradually, easily rationalized, easy to dismiss. I want you to consider something as we move into the deeper mechanisms of kidney disease. Your kidneys aren't just filters. They're endocrine organs producing hormones that regulate blood pressure, bone health, and red blood cell production. They're biochemical plants processing the waste products of metabolism. They're mineral managers keeping calcium, phosphorus, potassium, and sodium in precise balance. When these systems begin failing, the ripple effects extend throughout your entire body. This is why prevention, or if prevention is no longer possible, early intervention, becomes so critical. The medications and lifestyle changes that George implemented address the root mechanisms driving kidney disease progression. They're not treating symptoms. They're addressing the underlying pathophysiology that causes progressive decline. Now I want to transition into what most people don't understand about kidney disease progression. There's a crucial factor that determines whether someone follows George's trajectory of stabilization or whether they progress more rapidly toward dialysis and transplantation. And it's something you can actually influence significantly through your choices today. Think of your kidneys like a savings account. You're born with a certain kidney function, your deposit. Throughout life, various factors make withdrawals. Some withdrawals are inevitable. Some are optional, determined by your choices. Every action either preserves or depletes kidney reserve. Conventional medicine treats disease once diagnosed. Real power lies in preserving function before disease becomes apparent. First factor is uncontrolled high blood pressure. Blood pressure damages glomeruli through hypertensive nephropathy. Each year of elevated pressure creates cumulative damage. Aggressive control protects kidney function beyond preventing strokes and heart attacks. George's nephrologist targeted less than 120 systolic, more aggressive than traditional guidelines, specifically protecting remaining function. Second, and this connects to George's experience, is uncontrolled blood sugar. Diabetes causes kidney disease through a process where high glucose levels glycate proteins in the filtration membrane. I'm using simple language here, but essentially sugar damages the filter. Over time, these microdamages accumulate until the kidneys lose their filtering ability. This is why type 2 diabetes is the leading cause of kidney disease in developed nations. Now here's the whistleblower aspect that most conventional doctors won't emphasize. You don't need to have diabetes to have blood sugar dysregulation that damages your kidneys. Prediabetes, metabolic syndrome, and even insulin resistance without formal diabetes can create this damage at a slower rate. Preventing blood sugar problems entirely is exponentially more effective than treating them after diabetes develops. Third is chronic use of certain medications without proper kidney monitoring. NSAIDs like ibuprofen and naproxen, which many people use casually for headaches and joint pain, can cause significant kidney damage with regular use. George discovered during his pharmacy review that he'd been recommending these medications to patients for decades without adequately warning about kidney risks, particularly in people over 65 or those with existing kidney disease. The irony is that people take these medications to reduce joint pain or inflammation, unaware that chronic use might be accelerating kidney disease that will eventually cause far greater health challenges. This is the gap between what patients assume about over-the-counter medications and what actually happens inside their bodies. Fourth is obesity. Excess weight, particularly visceral fat surrounding organs, creates a pro-inflammatory state throughout your body. This chronic inflammation damages kidney structures over time. Additionally, obesity is strongly associated with both high blood pressure and blood sugar dysregulation, creating a compounding effect on kidney function. Now here's where I need to introduce a concept that might seem to contradict everything you've been told about healthy eating. Some popular diets high in protein have the potential to accelerate kidney function decline, particularly in people with existing kidney disease or risk factors. This doesn't mean protein is bad. It means excessive protein in the context of declining kidney function increases the workload on your remaining kidney tissue, potentially accelerating decline. George had to adjust his thinking here. As someone interested in health and fitness, he'd been consuming elevated protein quantities, sometimes exceeding 2 grams per kilogram of body weight daily. Once his kidney disease was diagnosed, his nephrologist adjusted his target to approximately 0.8 grams per kilogram. This seemingly small change actually reduces the uremic load on his kidneys, potentially slowing progression. Fifth is chronic dehydration. Your kidneys require adequate hydration to function optimally. Mild chronic dehydration doesn't just leave you thirsty. It actually stresses your kidney function, requiring them to work harder to concentrate urine and conserve fluid. Over years and decades, this chronic stress contributes to declining function. The irony is that some kidney disease patients develop an aversion to drinking water because they fear it will stress their already compromised kidneys. Actually, the opposite is true until kidney function becomes severely compromised. Adequate hydration with appropriate electrolyte balance actually supports kidney function. Now let's talk about the sixth factor that depletes kidney reserve. Chronic untreated sleep apnea. Research is increasingly showing that the episodic hypoxia, the repeated drops in blood oxygen that occur in sleep apnea, directly damages kidney tissue. People with untreated sleep apnea have higher rates of kidney disease progression. If you experience loud snoring, witnessed apneas, or daytime sleepiness, getting evaluated for sleep apnea becomes a kidney protective strategy. Seventh is chronic inflammatory conditions left unmanaged. Conditions like lupus, vasculitis, and even rheumatoid arthritis can directly attack kidney tissue through immune mechanisms. Additionally, chronic inflammation anywhere in your body creates systemic stress that compromises kidney function over time. This is where anti-inflammatory interventions become kidney protective beyond their immediate benefits for the primary condition. Eighth is excessive alcohol consumption. Chronic heavy drinking creates oxidative stress throughout your body, damages kidney tissue directly, and elevates blood pressure, creating a compounding effect on kidney health. Moderate consumption is less problematic, but chronic heavy use definitely accelerates kidney function decline. Finally, ninth is untreated or unmanaged gum disease. I know this sounds disconnected, but emerging research shows that severe periodontal disease creates systemic inflammation that damages kidney tissue. The bacteria from gum disease can enter the bloodstream through inflamed gums and trigger inflammatory responses that damage kidney structures. Additionally, poor dental health is associated with poor overall health choices, so there's likely a compounding behavioral factor. Most factors are modifiable. Their choices accumulating over time. George could have started at 35, 45, or 55. Instead, he addressed them at 72. This is hopeful because you don't need medical background to understand. You need honesty about which factors apply. Yes, to controlling blood pressure, managing blood sugar, using medications thoughtfully, maintaining weight, staying hydrated, sleeping well, managing inflammation, limiting alcohol, caring for teeth. Yes, deposits into kidney reserve. No, withdraws. These deposits don't feel impactful immediately, but compound over years into preserved or declining function. This brings us to the second transition. We've discussed what depletes your kidney reserve and what George did to stabilize his. But now I want to address the myth that most people believe about kidney disease that keeps them from acting. And this myth might be the single biggest barrier to your own kidney health. The myth is this: you can't do anything about kidney disease once it's started. You're on a one-way trajectory toward dialysis and transplantation. The damage is done. Give up. Accept it. This myth is so pervasive that I see it in patients' eyes when they receive a kidney disease diagnosis. A look of resignation. As if their body has betrayed them and there's no pathway forward except dependence on medical technology. But George's story directly contradicts this myth. Yes, the damage to his kidneys was real. He couldn't restore what was lost. But he stabilized what remained. And stabilization at moderate kidney disease is exponentially better than progression to severe disease. Here's what the evidence shows, and this is important. The rate of kidney function decline is not predetermined. It's not like you get a certain diagnosis and automatically progress at a predictable rate. The rate of decline is determined by modifiable factors. Control your blood pressure aggressively. Stabilize your blood sugar. Protect yourself from medications that accelerate decline. Maintain a healthy weight. Stay hydrated. Manage inflammation. Take care of your teeth. These interventions don't just help a little bit. They can reduce your rate of decline by somewhere between 27 and 63% depending on the specific intervention. In George's case, the combination of aggressive blood pressure control, SGLT2 inhibitor medication, dietary modification, and lifestyle changes appears to have slowed his decline from a predicted 5% annual loss of kidney function to less than 1% annually. That's the difference between dialysis dependency within 5 years and stability over decades. If kidney disease is modifiable, why don't doctors emphasize prevention? The system is optimized to treat disease, not prevent it. Healthcare providers get paid for diagnosed conditions, not prevention. Primary care doctors see patients for 15 minutes, inadequate for prevention discussion. Pharmaceutical companies profit more from treatment than prevention. George understood you must take personal responsibility. Request a metabolic panel. Educate yourself about risk factors. Modify what you can. Ask your doctor about kidney protective medications even without diagnosed disease. This is the whistleblower insight that separates people who preserve their health from people who decline into preventable disease. You can't wait for the system to protect you. You have to take personal responsibility for understanding your risks and acting on that understanding. Now, let me address something that George struggled with emotionally after his diagnosis. He felt guilt. He felt like he'd failed himself. As a pharmacist, he'd known about these risk factors for decades. He'd recommended medications and lifestyle changes to patients. But he hadn't applied that knowledge to himself. This emotional response is common, and I want to name it directly. Don't let it paralyze you. Whether you're 35 and hearing about kidney preservation for the first time, or 72 and discovering you already have moderate disease, this moment is where you can change your trajectory. The past is past. The only relevant question is what you choose to do starting today. The third transition brings us to something that most people never consider when thinking about kidney health. It's the intersection between your kidney function and your other major systems. Because your kidneys don't exist in isolation. They regulate blood pressure, mineral metabolism, red blood cell production, and acid-base balance. When kidney function declines, all of these systems begin to struggle. And understanding these interconnections completely changes how you approach your own health. When kidney function declines, your cardiovascular system struggles. Kidneys produce renin when sensing blood pressure drops or sodium changes, triggering angiotensin, a powerful vasoconstrictor. Healthy kidneys regulate this precisely. Failing kidneys lose regulation. George's blood pressure rose independent of sodium or weight, not from bad choices but from kidneys struggling to regulate. High blood pressure damages kidneys further, which damages blood pressure regulation further. Aggressive control becomes critical. Many people with elevated blood pressure don't consider that kidneys might initiate the problem, not the reverse. The second system affected is bone health. Healthy kidneys activate vitamin D, which is essential for calcium absorption and bone formation. When kidneys fail to activate vitamin D, calcium becomes depleted. Simultaneously, the kidneys fail to excrete phosphorus efficiently, so phosphorus builds up in the blood. This creates a catastrophic situation for bone health. Calcium is leached from bones to maintain blood calcium levels, while phosphorus accumulates, creating secondary hyperparathyroidism where the parathyroid glands become overactive trying to restore calcium balance. The result is progressive bone loss, increased fracture risk, and vascular calcification where phosphorus deposits in blood vessels, creating rigidity and increasing cardiovascular risk. George had to address this through careful dietary phosphorus restriction, vitamin D supplementation, and in some cases medication to bind phosphorus in his GI tract. The third system is your blood formation. As kidney function declines, erythropoietin production drops, and your bone marrow produces fewer red blood cells. This anemia is subtle at first. You just feel a bit more tired. But anemia means your tissues aren't getting adequate oxygen. Your heart has to work harder to pump oxygen-depleted blood. Your brain fog worsens. Your exercise tolerance drops. For some patients, this anemia becomes severe enough to require synthetic erythropoietin or blood transfusions. The fourth system affected is mineral metabolism beyond just calcium and phosphorus. Potassium becomes dangerous as kidney function declines. Healthy kidneys excrete potassium precisely, maintaining levels in the narrow range where your heart can beat normally. When kidney function is impaired, potassium accumulates. Elevated potassium causes life-threatening cardiac arrhythmias. This is why kidney disease patients have to restrict potassium intake, often dramatically. Foods like bananas, potatoes, and tomatoes become dangerous. Similarly, sodium retention can become problematic as kidneys fail to excrete sodium normally. This contributes to fluid retention, worsening blood pressure and creating edema. Yet paradoxically, some kidney disease patients develop sodium wasting where they lose sodium excessively, creating different problems. The system becomes incredibly complex. The fifth system is acid-base metabolism. Healthy kidneys maintain blood pH in a narrow range around 7.4. When kidneys fail, this balance is disrupted, leading to metabolic acidosis where blood becomes too acidic. This acidosis worsens bone disease, muscle wasting, and alters medication metabolism. Correcting this sometimes requires sodium bicarbonate supplementation. Now here's what most people don't understand about these interconnected systems. When you treat kidney disease, you're not just treating one problem. You're trying to regulate 5 or 6 different physiological systems that are tightly interdependent. Miss one aspect, and the others begin deteriorating. George's medical team had to coordinate across nephrologists, cardiologists, bone specialists, and hematologists to optimize his overall health. Prevention is exponentially better than treatment. Once treating failing kidneys, complexity overwhelms. You manage 10 to 15 medications, complex dietary restrictions, frequent monitoring, and appointments. Prevention is straightforward. Control blood pressure. Manage blood sugar. Stay active. Eat well. Stay hydrated. Now I want to transition into what might be happening inside your kidneys right now. You might be experiencing early kidney disease without knowing it. And I want to give you specific guidance on what to do about it. Because knowing is the first step toward intervening before irreversible damage occurs. The kidney disease spectrum moves through 5 stages. Stage 1 is normal kidney function with an estimated glomerular filtration rate, or eGFR, of 90 or higher. Many people at this stage might have early structural kidney disease, like elevated protein in their urine, but normal filtration function. This is the opportunity stage. This is when prevention is most powerful. Stage 2 is mild decrease in kidney function with an eGFR between 60 and 89. People often have no symptoms and no awareness of any kidney problem. This is where George probably was 5 years before his diagnosis. Stage 3A is mild to moderate decrease with an eGFR between 45 and 59. This is still before you usually experience symptoms. Stage 3B is moderate to significant decrease with an eGFR between 30 and 44. George was diagnosed at this stage. Symptoms might be emerging but are still subtle. Stage 4 is severe decrease with an eGFR between 15 and 29. Now symptoms become more apparent. Most people are preparing for kidney replacement therapy. Stage 5 is kidney failure with an eGFR below 15. Dialysis or transplantation becomes necessary to sustain life. The good news, and this is critical, is that the rate of progression through these stages is highly modifiable. Someone might progress from stage 3 to 4 over 5 years or over 30 years. The difference depends almost entirely on the interventions implemented and adherence to those interventions. Request a basic metabolic panel from your doctor if you haven't had kidney function checked recently. It costs $60 to $100 and includes creatinine, electrolytes, and glucose. Don't just accept normal. Ask about your eGFR, creatinine, urinary protein, electrolytes, and blood sugar specifically. These numbers reveal whether kidneys are struggling before symptoms emerge. If your eGFR is already in the stage 2 or 3 range, that's not a death sentence. That's a call to action. It means you have the opportunity to implement aggressive interventions before reaching the point where dialysis or transplantation becomes necessary. The interventions that work are the same ones George implemented. Aggressive blood pressure control. Blood sugar management. Dietary modification. Potentially kidney protective medications. Lifestyle changes. Regular monitoring. Now I want to address something specific that might apply to you. If you have a family history of kidney disease, your risk is elevated. If you have diabetes, your risk is elevated. If you have high blood pressure, your risk is elevated. If you're older than 65, your risk is elevated. If you're overweight, your risk is elevated. If you have certain autoimmune diseases, your risk is elevated. But here's the empowering part. Every single one of these risks becomes less dangerous when you have knowledge and when you act on that knowledge. A person with a family history of kidney disease who gets regular kidney function monitoring and implements protective interventions will almost certainly fare better than a person with no family history who ignores their kidneys entirely. This is where personal responsibility meets medical knowledge. You can't change your genetics. You can't change your past. But you can change your present trajectory through informed action. Let me give you specific, actionable steps you can take starting today. First, schedule a comprehensive metabolic panel if you haven't had one in the past year. Be specific with your doctor. Ask for your eGFR and creatinine values. Ask for a urinalysis to check for protein in your urine. Ask for your electrolytes, particularly potassium and sodium. Second, if you have high blood pressure, work with your doctor to achieve aggressive control below 120 systolic. This isn't just helpful for your heart. It's transformative for your kidneys. Third, if you have any blood sugar dysregulation, whether prediabetes or diabetes, make blood sugar management your priority. This might mean dietary changes, exercise, or medication. But controlling blood sugar is absolutely critical for kidney preservation. Fourth, evaluate your medication use. If you're taking NSAIDs regularly, discuss alternatives with your doctor. If you're taking medications that can affect kidney function, make sure your doctor is monitoring this with regular lab work. Fifth, Make dietary changes toward a kidney-protective diet. Reduce salt intake. Reduce processed foods where sodium is hidden. Be mindful of phosphorus and potassium intake as appropriate for your kidney function stage. Moderate protein intake if kidney function is already compromised. Focus on whole foods, vegetables, and healthy fats. 6th, commit to regular physical activity. Aim for at least 150 minutes of moderate aerobic activity weekly. This improves blood pressure, weight, blood sugar, and overall cardiovascular function. 7th, optimize your sleep and address sleep apnea if you have it. Use a CPAP if needed. This reduces the episodic hypoxia that damages kidney tissue. 8th, take care of your teeth. Dental health is actually kidney health. Poor gums mean systemic inflammation affecting your kidneys. 9th, limit alcohol consumption. For kidney health, moderate means 1 drink daily for women and 2 drinks daily for men. 10th, stay adequately hydrated. Unless you have advanced kidney disease where fluid restriction is needed, adequate hydration actually supports kidney function. Now here's what I want you to remember about George's story as we move into the conclusion. George didn't have some special advantage that allowed him to stabilize his kidney disease. He had knowledge, which he applied to himself. He had medical support, which he engaged with actively. He had motivation, which came from understanding what he risked losing if he didn't act. Most of all, he had willingness to change his habits despite being 72 years old. Many people assume that at 70, change is impossible. Your habits are fixed. Your body won't respond. You might as well accept decline. George proved otherwise. At 72, facing moderate kidney disease, he implemented comprehensive changes to his diet, exercise, stress management, and medication regimen. His results speak louder than any optimistic speech I could give. Now I want to acknowledge something that's true but often not discussed in health spaces. Kidney disease doesn't just affect your physical health. It affects your psychology, your identity, your sense of control. George had to grieve the version of himself who could eat and drink whatever he wanted without consequences. He had to accept quarterly doctor appointments and frequent lab work. He had to become vigilant about his health in ways he never had to be before. This grieving process is legitimate and important. But on the other side of grief is acceptance, and on the other side of acceptance is empowerment. Once George accepted that he had kidney disease, he could mobilize himself to protect his remaining function. The same applies to you. If your lab work comes back showing early kidney disease, allow yourself to feel disappointed, frustrated, even angry. That's healthy. But then move into action. Because here's the truth that most people never learn. Kidney disease diagnosed early is remarkably responsive to intervention. Kidney disease discovered late, when you're already experiencing severe symptoms, is much more challenging to manage. The difference between diagnosis at stage 3 and diagnosis at stage 5 is literally years of functional independence versus years of dependence on dialysis or transplantation. This is where the whistleblower aspect becomes most relevant. The medical system will manage your kidney disease if you develop it. But the system won't prevent it. The system will provide dialysis if your kidneys fail. But dialysis is reactive treatment, not true restoration of health. Your best protection is prevention or early intervention, and both of those fall primarily on your shoulders. You have to be willing to look at your own health honestly. You have to be willing to advocate for yourself with your doctor. You have to be willing to make dietary and lifestyle changes. You have to be willing to get lab work checked regularly even when you feel fine. You have to be willing to think about your kidneys today so you don't have to think about dialysis tomorrow. Now we're approaching the final transition. We've discussed what depletes kidney reserve, what George did to stabilize his disease, and what you can do to prevent or slow your own kidney disease progression. The final message is about hope and ownership. Let me be direct about something that might be running through your mind right now. If you're in stage 4 or 5 kidney disease, if you're already preparing for dialysis or transplantation, does any of this matter? Can you still influence your trajectory? The answer is yes, absolutely. Even in advanced kidney disease, aggressive management of blood pressure, blood sugar, nutrition, and general health can slow progression toward kidney replacement therapy. Some people who are projected to need dialysis within 2 years remain dialysis-free for 5 or 10 years through comprehensive management. That's not insignificant. That's years of independence and quality of life. But more importantly, if you're watching this and you don't have kidney disease yet, this is your moment. This is the moment where knowledge becomes power. George didn't invent the interventions that stabilized his disease. They've been available in the medical literature for years. Harvard Medical School, Johns Hopkins University, Mayo Clinic, and other leading institutions have been publishing research about kidney protective strategies for decades. But this knowledge hasn't reached most people because it's embedded in medical journals and specialist literature. What I'm doing by telling George's story and explaining these mechanisms is translating that knowledge into language you can understand and use. That's the whistleblower role. Making visible what should have been visible all along. Helping people understand that their kidney health isn't determined by genetics or bad luck. It's determined by choices they make every single day. High-protein and carnivore diets appeal through rapid weight loss and strength imagery. But for kidney health, they're potentially dangerous. High-protein intake accelerates kidney disease progression by increasing filtration workload. Conventional advice emphasizing protein for satiety can harm kidney health. You need adequate protein for muscle maintenance, but adequate differs from excessive without monitoring. The sweet spot for most people with declining kidney function is somewhere around 0.8 grams of protein per kilogram of body weight. For a 180-pound man, that's about 65 grams of protein daily. To someone eating a high-protein diet, this might sound restrictive. But combined with careful carbohydrate and fat intake, this level of protein maintains muscle mass while protecting kidney function. Now I want to address the emotional component of living with kidney disease or the knowledge that kidney disease runs in your family. There's a tendency to catastrophize, to assume the worst outcome, to feel hopeless. But George's story demonstrates that even a serious diagnosis like moderate kidney disease doesn't determine your trajectory. Management does. Furthermore, if you're someone who's taking this video as a wake-up call, as a reason to finally get your kidney function checked and start taking these factors seriously, then you're in the optimal position. You get to make the decisions that George made at 72, but potentially decades earlier when your kidneys are less compromised and more responsive to intervention. Think about it this way. If you implement kidney protective strategies today and you're in your 50s or early 60s, you might preserve enough kidney function that you never encounter advanced kidney disease. You might age with stable kidney function that never becomes a limiting factor in your quality of life. That's an outcome worth pursuing. Let me now address something that might seem like a detour but is actually central to the story. George worked in pharmacy for 40 years. He dispensed medications, counseled patients about side effects, explained drug interactions. But in all those years, he never had a doctor sit down with him and explain his individual kidney disease risk or what he could do to prevent kidney disease. This isn't because his doctors were incompetent. It's because the medical system isn't structured to prevent disease in people who don't have disease yet. Here's where your agency becomes critical. You can't wait for a doctor to approach you with a comprehensive kidney disease prevention plan. That's not how the system works. You have to be proactive. You have to understand that kidney disease prevention is primarily in your hands. You have to get your kidney function checked. You have to understand your risk factors. You have to make the choices that matter. This is deeply empowering when you recognize it. It means that your health outcome isn't determined by the luck of the draw or by random genetics. It's determined by knowledge and action. Two people with identical genetics can have completely different kidney disease outcomes based on their choices about blood pressure management, blood sugar control, diet, exercise, and preventive monitoring. Now let me address one more myth that I encounter constantly. People assume that kidney disease is somehow shameful, something they caused through bad living. This isn't true. Kidney disease results from complex interactions between genetics, environment, and choices. Some people with perfect diets, exercise routines, and healthy weights develop kidney disease because of genetic predisposition or autoimmune disease. Some people with poor habits never develop kidney disease because their genetics are protective. But here's the truth that matters. Whether your kidney disease comes from genetics or choices or a combination, you can still influence your trajectory forward. You can still implement interventions that slow progression. You can still preserve years of quality life. And if you don't have kidney disease yet, you can still take steps today to reduce your risk. George eventually made peace with his kidney disease diagnosis. He stopped seeing it as a failure and started seeing it as information. Information that told him his kidneys needed specific support. Information that guided his dietary choices. Information that shaped his approach to medication and supplementation. Information that oriented his exercise routines toward cardiovascular health and kidney protection. In a strange way, his kidney disease diagnosis was a gift because it forced him to take aspects of his health seriously that he'd neglected for decades. Many people who received similar diagnoses at similar ages have actually reported that their health improved dramatically after the initial shock, simply because they finally had a clear reason to prioritize the changes they'd been putting off. I want to close with a direct message about hope. If your lab work shows early kidney disease, if your doctor mentions that your kidney function is declining, if family history suggests you're at risk, this is not a death sentence. This is a call to action. The progression from moderate kidney disease to severe kidney disease is not inevitable. It's determined by modifiable factors. It's determined by choices you make over months and years. George started with stage 3B kidney disease and an estimated progression trajectory that would have him in dialysis within 5 years. 3 years later, his kidney function is stable. He's not moving toward dialysis. He's living his life with the confidence that his remaining kidney function will support him indefinitely if he maintains the interventions he's committed to. George had medical knowledge and access to a good nephrologist. You now have that knowledge. You can watch, feel concern momentarily, then continue unchanged. Or you can use this as catalyst. Get kidney function checked. Understand risk factors. Make dietary changes. Optimize exercise. Control blood pressure and blood sugar. Be proactive. Habit change research shows emotional intensity drives sustained decisions. George's story hopefully creates resonance that prompts action rather than passive interest. One step at a time, one day at a time, you have got this. Whether you're facing a kidney disease diagnosis or you're taking preventive action, you have agency. You have the ability to influence your health trajectory through informed choices. Everyone watching knows someone unaware of kidney function status, making choices accelerating disease. Consider sharing this video. It might literally change their trajectory. If you have questions about kidney health, leave a comment. You deserve to feel good in your body, to age without kidney disease burdening your life. You deserve knowledge to protect your health. This is foundational information every adult should understand. I believe in you, and I will be right here with more information next week. Thank you for trusting me with your health journey. Together, we are building a community that heals, that acts before it's too late, that recognizes that our health is our greatest wealth and it deserves our protection. One step at a time. One day at a time. You have got this.